Right, let's take you back to that breaking news story. The KwaZulu-Natal Health Department says the province is aware of 2 suspected coronavirus cases and has stressed that there is, at this stage, no laboratory confirmation. One of the cases is being handled at a state hospital while the other is at a private facility. We now speak to Dr. Anban Pillay from the National Health Department, Deputy Director General. Dr. Pillay, a very good evening to you. Thank you so much for speaking to us. Do you know anything as yet, besides the information that I've given in the introduction, about those 2 suspected cases in KwaZulu-Natal?
Good evening to you and good evening to your listeners. No, there are a number of cases that are sent to us where there's a level of suspicion depending on the presenting features. But to date, we've not got any case that's positive. Neither do we have any case that meets what we call the full case definition. In other words, an individual that has been to the area of the epicenter of this outbreak or has been in contact with people in the epicenter and is within the incubation period or thereafter presenting with symptoms. So at this stage, there is no one that has tested positive.
As you say that it's about the symptoms that are presented, which are ones that are taken seriously enough that the National Health Department the Health Department in KwaZulu-Natal should be concerned about. It says there are no lab tests or confirmation as yet, but surely there is some symptoms that they're presenting that they feel should be serious enough to be isolated.
Well, anyone that basically presents with a fever, a sore throat, and some sort of chest infection and some mucosal infection as well would obviously be an individual to consider. But in addition to that, they would obviously have to travel to the area where the epicenter is, which is the Wuhan city, or to the Hubei area within China, or other areas within China where the outbreak is known to have occurred, or be in contact with people from that area. That would be the primary reason why we would suspect such individuals. But as a precautionary measure, we are testing other individuals as well, just to be sure that they are excluded in terms of coronavirus.
So how many more individuals are being tested? Because we also know about the case in Limpopo, just to get a countrywide picture of suspected cases or feared cases.
No, there are many cases. I mean, we're getting doctors, private and public, calling into our hotline, presenting us with the clinical picture of the patients. But none of those patients so far have met the true case definition, because if they met the case definition even before us actually doing the testing, we would isolate those patients, put them into some sort of a quarantine environment until the results come back, which usually takes about 24 hours for us to run all the tests.
So in Limpopo, you would have had some sort of result because that was reported early in the week already. And when you say many cases, are you able to at least give us a figure? Is it a dozen? Is it more than a dozen that an alarm has been?
It's more like about 30, 40 a day.
Where the alarm has been raised about patients?
Yes, I'm happy that clinicians have a high level of suspicion and surveillance. So the likelihood of us detecting a case early will be much better. So it's important that I think clinicians do that.
So the Limpopo case, have we heard anything beyond the fact that that patient was quarantined and tested? You said it takes about 24 days to get a clearer picture of whether or not there is an issue of grave concern.
Yeah, so no, there is no case in Limpopo as well. As I said, in the country, there is no case at all.
Okay. So we know that there are hospitals that have been capacitated to deal with this should one present itself with the full spectrum, which you mentioned, of someone who's very much in danger of catching the coronavirus. But what else are we doing as a country beyond the screening stations, but also information campaign?
Well, the virus is a droplet spread infection. So the most important thing is to advise people not to be in contact with large crowds where you could potentially acquire the infection through droplet spread infection. We're screening people, obviously, at the airport. We're using two methodologies there as well as a foolproof mechanism in case one of the mechanisms is not as sensitive. Both mechanisms are being used. We're educating individuals across the sectors where there's high concentration of people in workplaces, schools, etc., to understand what would be the signs and symptoms so that they can refer such patients in early.
Okay, so Dr. Pillay, I need to ask this question in terms of precautionary measures. I know while this is not a matter for the National Department of Health, but you obviously would be on the front lines in terms of dealing with any South Africans returning from China or Wuhan. We mentioned the fact that there are students who have been stuck there who are begging to return back home. What precautions would you take, and would you advise, say, the Department of International Relations that perhaps there needs to be a plan put in place to bring them back to prevent any outbreaks?
Well, if the decision is taken to bring them back, they would have to come back and have to be within an isolation quarantine environment for a period of the incubation of the virus, which will be about 14 days, before we would be able to clear them to go back into their communities. Simply because there have been many cases where countries have been involved in taking their citizens back, and they've been infected. Some of them have been, and obviously they've infected the entire aircraft that they've been in contact with those people. So we need to make sure we take that precaution.
Okay.
We would also not bring back somebody who is infected, because obviously that poses a risk to the other individuals in the economy.
You are obviously in collaboration with the international expert scientists on what characteristics the virus is presenting with. It's still a bit of an enigma in terms of the other coronaviruses that have been reported, but are you getting any new information from scientists of how it's mutating or anything else?
Yes, the World Health Organization has an expert team which has been put together, and on a daily basis they provide feedback to all member states about the latest scientific information as well as the spread of the infection, etc. At this stage, it appears that the virus is not mutating to an extent that needs to be worried about. There's also limited evidence that there's transmission in asymptomatic individuals. It appears to be the biggest risk is in symptomatic individuals. And so they're continuing to do some work around whether there are any particular antivirals, for example, that may be effective in suppressing the virus. But to date, we've got no evidence of which drug that would be. But they're busy working on that strategy.
All right. Thank you so much for speaking to us, Deputy Director General in the Department of Health, Dr. Anban Pillay.